Hey everybody, welcome to Journey to Vitality. In this video, we dive into the top 6 vitamins essential for healing your nerves and reclaiming your health. Did you know the right vitamins can be a game changer for your nerve health? Today, we're exploring the top 6 essential vitamins for naturally maintaining and healing your nerves. From anti-inflammatory omega-3s to critical nerve antioxidants, these nutrients are pivotal in keeping your nervous system in shape. So, let's dive into vitamins and discover how they can support your nerve health. Number 6. Vitamin B1, thiamine. Vitamin B1, known as thiamine, is crucial for maintaining nerve health and overall neurological function. It plays a vital role in converting carbohydrates into energy, which is essential for the proper functioning of nerve cells. Thiamine is involved in the synthesis of acetylcholine, a neurotransmitter important for muscle contraction and nerve signal transmission. This vitamin also maintains the myelin sheath, the protective covering around nerve fibers that ensures rapid and efficient signal transmission. Research has demonstrated that thiamine supplementation can significantly improve nerve function and reduce symptoms of neuropathy, particularly in individuals with diabetes. Diabetic neuropathy, a common complication of diabetes, leads to nerve damage due to high blood sugar levels. Studies have shown that thiamine can help reduce the accumulation of advanced glycation end products, AGEs, harmful compounds that contribute to nerve damage in diabetics. By lowering AGE levels, thiamine helps protect nerves and improve their function. In addition to its benefits for diabetics, thiamine has shown promise in treating other neuropathies. For example, research indicates that thiamine supplementation can alleviate symptoms of peripheral neuropathy, characterized by tingling, numbness, and pain in the extremities. This is particularly relevant for individuals undergoing chemotherapy, which can cause neuropathy as a side effect. Thiamine helps by supporting nerve regeneration and reducing oxidative stress, often elevated in neuropathic conditions. Number 5. Vitamin B6, pyridoxine. Vitamin B6, or pyridoxine, is crucial in maintaining nerve health. Producing neurotransmitters, the chemicals that transmit signals between nerve cells, is essential. Neurotransmitters like serotonin, dopamine, and gamma-aminobutyric acid, GABA, rely on adequate levels of vitamin B6 for their synthesis. These neurotransmitters are critical for regulating mood, sleep, and cognitive functions, all linked to the nervous system's overall health. Without sufficient vitamin B6, the nervous system cannot function optimally, leading to various neurological issues. One of the critical roles of vitamin B6 is in the formation of myelin, the protective sheath that surrounds nerve fibers. Myelin ensures the rapid and efficient transmission of electrical signals along the nerves. When vitamin B6 levels are inadequate, the integrity of the myelin sheath can be compromised, leading to delayed or disrupted nerve signaling. This can manifest in symptoms such as tingling, numbness, or burning sensations, commonly associated with peripheral neuropathy. Ensuring adequate intake of vitamin B6 can help maintain the myelin sheath and prevent these symptoms. Vitamin B6 is particularly effective in reducing symptoms of carpal tunnel syndrome, a condition characterized by compression of the median nerve in the wrist. Research indicates that vitamin B6 supplementation can alleviate pain and improve hand strength and functionality in individuals with this condition. This is likely due to vitamin B6's role in neurotransmitter synthesis and its anti-inflammatory properties, which help reduce nerve inflammation and facilitate nerve repair. Number 4. Vitamin B12, cobalamin. Vitamin B12, also known as cobalamin, is essential for maintaining the health of the nervous system. It plays a crucial role in synthesizing myelin. This protective sheath covers nerve fibers and ensures the efficient transmission of electrical signals between the brain and the rest of the body. Without sufficient B12, myelin can deteriorate, leading to nerve damage and impaired neurological function. Deficiency in vitamin B12 is linked to a range of neurological and psychiatric disorders, including peripheral neuropathy, which is characterized by numbness, tingling, and pain in the extremities. This condition is particularly prevalent in older adults and people with certain medical conditions, such as pernicious anemia or gastrointestinal disorders that impair nutrient absorption. Additionally, strict vegetarians and vegans are at higher risk of B12 deficiency because this vitamin is primarily found in animal products. Research has demonstrated that B12 supplementation can significantly improve nerve health and function. For individuals with a deficiency, taking B12 supplements can lead to the regeneration of nerve cells and a reduction in neuropathic symptoms. A study published in the Journal of the Neurological Sciences found that patients with diabetic neuropathy experienced notable pain relief and nerve regeneration after consistent B12 supplementation. Number 3. Vitamin D. Vitamin D is essential for numerous bodily functions, and its role in nerve health is increasingly recognized. It supports nerve growth and repair by aiding in synthesizing neurotrophins, which are proteins that promote neurons' survival, development, and function. Additionally, vitamin D helps maintain the health of the myelin sheath, the protective covering surrounding nerve fibers, ensuring efficient transmission of nerve impulses. Anti-inflammatory properties. One of the key benefits of vitamin D for nerve health is its anti-inflammatory properties. Chronic inflammation can damage nerves and exacerbate pain in conditions like neuropathy. Vitamin D helps modulate the immune response, reducing inflammation and potentially alleviating nerve pain. This anti-inflammatory effect is crucial in managing autoimmune diseases such as multiple sclerosis, MS, where the body's immune system attacks the myelin sheath. Numerous studies have linked low vitamin D levels to increased nerve pain and dysfunction risk. For instance, a study published in the journal Pain Medicine found that patients with chronic pain often have significantly lower vitamin D levels than healthy individuals. This deficiency can lead to peripheral neuropathy, where damage to peripheral nerves causes weakness, numbness, and pain, typically in the hands and feet. Number 2. Vitamin E. Vitamin E is a fat-soluble antioxidant that plays a crucial role in protecting cells from oxidative damage. This is particularly important for nerve cells, which are highly susceptible to oxidative stress due to their high metabolic rate and oxygen consumption. Vitamin E helps neutralize free radicals, unstable molecules that can damage cellular structures, including nerve cells. By mitigating oxidative stress, vitamin E helps maintain the integrity and function of the nervous system. The antioxidant properties of vitamin E are vital in preventing the degeneration of nerve cells. Oxidative stress is a major contributing factor to neurodegenerative diseases and neuropathies. Studies have shown that vitamin E can reduce oxidative stress markers in the body, thereby protecting nerve cells. This antioxidant capability is crucial in conditions where oxidative damage is prevalent, such as diabetic neuropathy and chemotherapy-induced neuropathy. Vitamin E protects nerve cells from damage and supports their regeneration. Research has indicated that vitamin E can enhance the repair and regrowth of nerve fibers. In animal studies, vitamin E supplementation has been shown to promote the regeneration of damaged nerves, leading to improved functional recovery. This regenerative effect makes vitamin E a promising nutrient for aiding recovery from nerve injuries. Number 1. Alpha-lipoic acid, ALA. ALA enhances the production of glutathione, one of the body's most important antioxidants, which helps protect nerve cells from damage. It also chelates metal ions, reducing their ability to produce harmful free radicals. By reducing oxidative stress, ALA helps preserve the integrity of nerve cells and promotes their repair. Additionally, ALA improves blood flow to nerves, ensuring they receive sufficient oxygen and nutrients to function optimally and regenerate. Numerous studies have demonstrated the efficacy of ALA in treating neuropathy, particularly diabetic neuropathy. Research published in Diabetes Care Journal showed that ALA significantly reduced symptoms such as pain, burning, and numbness in diabetic patients. Another study in Current Medical Research and Opinion found that ALA improved nerve conduction velocity, enhancing nerve function. These findings highlight ALA's potential as a therapeutic agent for nerve damage and neuropathic pain. In clinical settings, ALA is often used as a treatment for various forms of neuropathy. It is administered orally or intravenously, depending on the severity of the condition. For diabetic neuropathy, A common regimen includes an initial high-dose intravenous infusion followed by oral supplementation. This approach has been shown to provide rapid relief from symptoms and promote long-term nerve health. Patients often report significant pain levels and overall nerve function improvements with consistent use. In conclusion, a well-balanced diet rich in these B vitamins can significantly support your nervous system's health. However, it's important to remember that these vitamins are just one piece of the puzzle. That's all we have for you today. These are the top 6 vitamins for healing your nerves naturally. If you found this helpful, give the video a thumbs up. And for more tips on healthy living, hit that subscribe button so you never miss a video. Until next time, stay happy and healthy.